Hi, this is Dr. Danish. I wanted to talk about how we figure out what the origin of pain is. When we first started our practice, one of our taglines was seeking the source to your pain. And the reason it was seeking the source to your pain is because a lot of times we label pain as something like, for instance, we say degenerative disc disease or osteoarthritis or sprained ankle. But those are very vague terms and they don't really tell us what's going on in the body. It'd be the equivalent of saying somebody has cancer, but not really going into detail as to what kind of cancer it is and what needs to be done to treat it. So when those instruments don't exist, when you don't have a microscope, you're never going to find a cell as the cause of an infection. And it's the same thing in healthcare. We don't do enough understanding of the origins of pain to really get a pinpoint diagnosis. And that's why a lot of people go through what I call the hope and despair cycle, where they seek medical treatment, something is offered to them, it doesn't really work, and then they're back to square one. Well, people only go through that a few cycles before they completely give up, and we don't want people to give up because the solutions are out there. We can actually have a much better understanding of what's going on in the body. Take, for instance, here's a shoulder. I'm going to actually work down here to the wrist. So the wrist is composed of a lot of different tissues. There's the muscles and that muscles that become tendons and they go into the wrist. Then if you take away all of this, you've got all of these different ligaments that hold the wrist together. And if we get rid of that, you've got all of these bones, any one of which could be loose because of a ligament problem, and that rubbing will constantly cause further and further erosion. To further complicate things, in this structure, in this body, you've also got a whole constellation of nerves that get sandwiched by all of these ligaments and all of these tendons and muscles. And so it becomes a kind of a difficult problem to figure out why somebody hurts and how do you get to a solution without knowing exactly what structure is the problem. And if you think about what you typically get, you get an X-ray, you get an MRI, but a lot of those structures either don't look at the entire complex of that organ, and I'm calling a joint an organ, or they don't see it in motion. Well, one of the things that we do in our office is we've got ultrasound, which is a live visualization of all of the tissue, from muscles to tendons to ligaments to nerves, all the way down to bone. You can see the contour of bone by looking at an ultrasound. And we use that ultrasound in live diagnostic tests where we stress the body in different shapes and different movements and different stresses, as well as we numb particular parts of that using the ultrasound. We can be extraordinarily discrete and accurate when we target a structure and we numb that one structure, and we can do that in order to figure out, is the problem really coming from the ligament, the tendon, the muscle, the joint, the bone? Any one of these could be problems. And with standard healthcare techniques of just getting an X-ray or an MRI, you're not going to get that kind of definition or fidelity. And if you have and you've sought treatment that didn't work, by all means, give us a call, because we have a process called pain mapping, particularly for people who have had failed treatments. We use pain mapping as a process to progressively identify the specific cause of pain, rather than just using an X-ray and MRI to make our best guess. We're able to do so as the patient is in our office using any technique that we need to figure that out. So if you have a question about pain mapping or have an issue that you want a quick solution on, feel free to reach out to us and make an appointment. It's a great idea to do so before that problem evolves into other problems. So feel free to reach out to us. Happy to help. Good to talk to you. Thank you.